Joining us live right now is Dr. Joe Congini, Akron Children's Hospital. Joe, I saw the other day, and I've been waiting, and I was talking to Tim Alcorn about Dylan Windler with the Cavaliers, one of our first-round draft picks, when we're going to see him. And Tim was telling me, hey, when he shoots, they go in. Can't wait to see him play. And then I saw it come across that a couple of days ago, he's out for the year. Talk about he's got a stress fracture, is that right?
Yeah, it is confusing to people, and for those of people that are still paying attention to the Cavs, I hope they are. I mean, good young team and growing all the time. They say that, Coach Beilein really liked this kid out of Belmont. He's a wing and a really great shooter with incredible range and everything. And when they went to camp, they talked about him having a stress reaction, stress fracture, maybe a couple of months, 6 to 8 weeks. And it certainly was taking longer than that from October into November, December. Then there was some discussion about that he was practicing. He got to the point of 3-on-3, might have even played in a Canton game or two and some scrimmages. And then in the last week they shut him down, and the announcement, I believe was yesterday, was that he's going to need surgery. So this does happen sometimes, and because we have stress fractures so frequently in younger athletes, I did want to talk about the fact they don't all heal. And that's a bit of a problem. So the majority do. And with the vast majority of stress fractures and stress injuries in the shin, in the back, in other areas, these usually go on to healing with rest, and then we do physical therapy and rehabilitation to get their strength back, and then they return to play. And in most bones, it's 6 to 8 weeks. And so in this case, it was a little bit of a head-scratcher, but this is a injury rate called the dreaded black line much of the time. It actually goes the other way. Instead of over that period of time of healing of the first couple of months on the old-fashioned x-rays, that's where it got its name, instead of seeing that nice white healing, we call it sclerosis in the bone, you start to see this blackening line that it's just not going to heal very well. And there's certain fractures that are more prone to going on to the dreaded black line. But if it gets to a point where it's not healing well, in this day and age, of course, they would, somebody like him, do advanced imaging, see it's not going to heal, and they end up having to go to surgery with usually instrumentation like a rod they put in the bone to actually hold that fracture together.
So what does this do for Dylan's future in the NBA, Joe?
We do a lot better with these than we used to, but it does put a little bit of a question mark over this young player. Probably the best known ever, and you got to go back a ways. But sorry about that. I know sometimes your audience likes the history of sports, and there was a guy by the name of Sam Bowie who got drafted before Michael Jordan in the NBA draft. It was Akeem Olajuwon number 2, Sam Bowie out of Kentucky number 2. Olajuwon 1, Bowie 2. Michael Jordan was the third pick. And Sam Bowie got the dreaded black line. And he fractured that bone 4 or 5 times before he was out of the league and never playing again. But again, we didn't understand as much then about the dreaded black line, what leads to people not healing. Sometimes there's other metabolic or endocrine hormonal reasons why they don't heal, Ray. And so, of course, all that workup's been done on him. There's things like, hey, is there a vitamin D deficiency or calcium problem? Or is there a hormonal problem that's leading to the fact that his bones may be weaker? So most people, it's normal bone, increased stress to the bone leading to stress fracture. For some people, it's just a same amount of stress as anybody else on a weakened bone, and then they get a stress fracture, and then it doesn't heal and goes on to the dreaded black line. But I would tell you, we're much better now than we were. That's 30 years ago, 35 years ago with the Sam Bowie fracture. Many more people do get back to a full and healthful career, but obviously not the way to start your first year in the NBA with sitting out the entire year.
Yeah, I agree. Joe, great stuff this morning. Thank you for the insight and certainly paying attention to that for us, and we'll catch up with you next week.
Okay, Ray, have a great week.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital, joining us live this morning here on the Ray Horner Morning Show.